Hi, I'm Dr. Sian Cole, Senior Health Psychologist. And this video is an introduction to acceptance and commitment therapy, or ACT for short. So first off, there's two main goals that we're working on. The first one is about acceptance of unwanted thoughts and feelings. And the second one is about taking committed action. So these two are really important, and one of the reasons why we call acceptance and commitment therapy ACT for short is that we are focusing on things that we can control and understanding that there are things that we can't control, that we don't have personal control over. And one major thing that we don't have control over is our thoughts and feelings. And what we do have control over is our actions. So learning how to accept our thoughts and feelings and to take control of our actions towards creating a meaningful life, then that is our aim for this therapy. So what is ACT? Well, first off, we want to actually help people get in touch with what really matters in their life. So we connect with our values, understanding what motivates us, inspires us to actually help us make the behavior changes that we want to. And to do mindful action. So I've made some videos already on mindfulness, but we really want to use those skills in ACT to actually help people make those conscious decisions of their action. So what ACT does? Well, it teaches psychological skills, and there are a number of skills that acceptance and commitment therapy helps teach people. And these skills can actually help us be more present, understand our thoughts and feelings and how to handle those so they have less impact on our behaviors. So we have more control over what we do. ACT also helps us clarify what is important in our life, think about the big picture. Sometimes we get caught up in the daily grind of life and forget what we're putting up with this discomfort for. So ACT can help people do that and then set goals to actually work towards those values. So the main thing that ACT is actually wanting to actually help people with is to develop psychological flexibility, to be able to go with the ups and downs of life. ACT in no way is trying to make people feel good or happy all the time or to ever solve someone's depression and get rid of it forever, as that actually is an impossible task to work towards. It's more about having the skills to be able to deal with life. So I'm going to go through some of those now. So one thing that we want to do is be present. Us humans are pretty good at not being present or being on automatic pilot. So we've got a couple of skills that actually help us to be present. So that's contacting with the present moment. So that might be just engaging our senses to actually help us be in the here and now. And also a part of ourselves that can observe. So I've done some videos on these topics as well. Another really major part of being psychologically flexible is to be able to open up. And that involves being able to diffuse from our unhelpful thoughts and to accept our uncomfortable emotions. And the last bit is to do what matters, the action part. So we want to know what our values are because those are our life directions. And then we want to take committed action. It's not about being perfect, but it's setting goals and working towards our values and what really matters in our life. So just to go briefly back over that now, being present is about contacting the present moment, being engaged in what you're doing. Having a mindful cup of tea can be contacting the present moment, noticing what you're doing and being engaged in the activity. And then also observing, stepping back from our thinking selves and just observing what we're doing in the moment. So yes, mindfulness meditations can be a present activity, but also mindful exercise or mindful shower or mindful eating can also be other ways to actually build up these skills of being more present. Opening up. Look, these skills are probably the hardest skills to learn and practice. So that's why seeing a psychologist can be really important to actually help with these practicing. So being accepting of unpleasant experiences and being in the moment of it can be quite difficult. Sometimes I talk to my clients, it's like, you know, if you're learning to bench press, you don't start with the biggest weights in the gym, nor do you need to start with the biggest emotions or the most challenging thoughts. Sometimes it is about starting with something that's a little bit lighter and working your way up. These skills do take practice. Diffusion, I've done some videos on that, my diffusion video and the choice point. So it's about understanding our thoughts, so we don't have to have a deep relationship with every thought that we have. Some of them can be let go, just seeing them as bits of language passing through our mind. Do what matters. So this is the action part of acceptance and commitment therapy. So we use our values to find what our life stands for or what we want our life to stand for, giving us those life directions. This is what actually helps inspire and motivate us, gives our life meaning. And then the committed action is the part where we actually set our goals and work towards them. And again, psychologists, there are a number of skills that might be required. And again, this is just an overview of acceptance and commitment therapy. ACT. So this is a good little acronym to remember acceptance and commitment therapy and what it stands for. And that's about accepting our thoughts and feelings and being present with them, choosing a valued direction and taking action. So my choice point video or just learning about choice point is a great way of understanding ACT in action. Thanks for watching.